Okay, good morning. I'm Bonnie Flenner. I am the Regional Donor Service Executive for the Northern Ohio Biomedical team, and I would like to welcome you to today's panel discussion on the need to diversify our blood supply. I also want to note that today is Yom Kippur, and it's a solemn holy day for people of the Jewish faith. We wish a meaningful Yom Kippur to everyone who recognizes this as a day of atonement. We are recording this presentation for them and for anybody who was unable to join us in person or virtually. And to those of you who are joining virtually on Teams, we ask that you mute your microphones and turn off your cameras, and I think we've done a pretty good job of that already. So thank you all for coming again, and I would like to now introduce Gail McGovern virtually, who has recorded a message for us.
Hi, everyone. This is Gail McGovern, and I have the privilege of serving as the President and CEO of the American Red Cross. I'm sorry I can't join you in person for this morning's panel discussion, but I am delighted for the opportunity to share a few words with you. I want to start off by giving a great big thank you to everyone for graciously sharing your time with us. And I also want to express my sincere appreciation for all of today's panelists for sharing your personal experiences and expertise with us. My hope is that this morning's discussion will be an opportunity to learn more about the devastating impacts of sickle cell disease and to also better understand the critical need to recruit diverse blood donors. Sickle cell disease is the most common genetic blood disorder in the United States. In fact, it's estimated that over 100,000 people in our country have the disease, and the vast majority are African Americans or people of African descent. And there's no universal cure for sickle cell disease, and many patients require frequent blood transfusions throughout their lifetimes to help manage the extreme pain and life-threatening complications. For patients with sickle cell disease, blood donors of African descent are about 3 times more likely to be a match for the blood that's needed, compared with donors who are not Black or African American. And unfortunately, needing frequent transfusions can make finding compatible blood types more difficult. In order to ensure patients have the access to the blood products they need, the Red Cross launched our Sickle Cell Initiative last year, and we're working very hard to recruit more diverse blood donors and to educate the public on the critical need for the diverse blood supply. The good news is that in the first year of our campaign, the number of first-time African American donors at the Red Cross increased by 60%. But we still have more work ahead of us to make sure that the blood that sickle cell patients need is always available on hospital shelves. And a key part of this effort is to forge new partnerships with community organizations. And I am thrilled that the Red Cross has been working closely with a number of diverse groups to help spread the word and organize blood drives. And this includes national partnerships with organizations like the NAACP, 100 Black Men of America, the Links Incorporated, the Divine Nine Fraternities and Sororities, and Jack and Jill of America. But we also realize we can't do this without the assistance at the local level. And I know that many of you in attendance today are leaders in your organizations and communities. Your influence and support can play a critical role in making sure that we have the blood products needed to assist sickle cell patients. Again, I want to thank everyone in attendance for sharing your time with us this morning. I'm so grateful for your willingness to listen and learn, and I sincerely hope you'll help us spread the word about the critical need for a robust and diverse blood supply, both here in Northern Ohio and across the country. So thank you again, and I wish you the very best for a meaningful and informative discussion.
So when you hear Gail reference that number of 100,000 people with sickle cell disease, and then you think about the number of transfusions that those patients, are going to need over their lifetime, I think the math can be a little bit daunting, and that's what we're going to talk about today. But before we do that, I want to give a very brief overview of sickle cell disease, the treatment, and the importance that race and ethnicity play in that treatment. So as Gail referenced, sickle cell is the most common genetic disease in the United States. And basically, if two parents each carry the sickle cell trait, they have a 1 in 4 chance of having a child that has the sickle cell disease. And so here in the United States, the majority of people carrying the sickle cell trait are of African descent. And so what exactly is sickle cell? And I'm not going to go into a big, long medical explanation, but really, you know, our blood cells are red and round, and they flow freely throughout the body and oxygenate the organs throughout our body. But what happens when somebody has sickle cell is the cells become crescent-shaped or sickle-shaped, and they become hard. And that causes a lot of symptoms, including extreme pain, and can be up to organ damage and also stroke. So the main treatment for that is frequent blood transfusions. And some of our patients have as many as 10 transfusions a month, which is a significant amount of blood. The best treatment or the best unit for a patient with sickle cell is somebody that has the same race or ethnicity that they do. And that's because as you have more markers in your blood, you develop kind of like an allergic reaction to that. So African American donors, as Gail said, have 3 times more likely to match the blood for a sickle cell patient than are non-African American donors. And we have another presentation that we use sometimes in the community where we say if we collect 250 units from Caucasian donors, we'll find 1 match for a sickle cell patient. If we collect 250 units from Black donors, we can find 28 units that'll match. And 28 isn't a lot, but it's a lot better than just that 1 unit. So that's one of the reasons why the organization has launched on this initiative to triple our African American blood donor base by the year 2027. It is a daunting task, and I think that if you go to the next slide, you can see what our ask is today, right? There are some simple things that you can do to help, and one of them is to sign up and give blood. And when you do that, you can ask your friends and family to join you. So that would be the second thing that you can do. And then when you go donate blood, and this is really important, identify your race. And I know a lot of people are maybe a little bit uncomfortable with checking that box, but this is critically important because those are the units that we test on the back end for transfusion to patients. So it's very important that you check the box when you donate. And then consider making a financial gift to support the Red Cross Sickle Cell Initiative. We have a heavy lift over the next few years, and can use that assistance. Today, we'd like to share a little bit more with you about sickle cell from a couple different perspectives, and I'm going to introduce our panelists right now. And I believe we sent the bios out, but I'm going to go ahead and introduce them. And I'm going to start down here with Consuela Albright. Consuela is a board-certified nurse practitioner in family medicine and primary care pediatrics. Since 2019, she's a member of the Adult Sickle Cell Program at University Hospital's Seidman Cancer Center. Consuela received a Master's of Science degree from Case Western University, a Bachelor's of Science degree from Ohio State University, sorry about that, and an Associate's degree from Columbus State Community College. Her interests include patient education and advocacy for underserved communities. And then on the phone on the call is Glinda Dames-Fincher. Glinda has lived with sickle cell disease since birth 63 years ago and has an adult son with the sickle cell trait. So he carries one of those genes. For almost 40 years, Glinda has participated in sickle cell support groups and helped organize groups for adults and families affected with sickle cell. She serves as a volunteer medical advisor for Kincaid's Kindred Spirits, a nonprofit adult sickle cell support and youth mentoring program. Glinda is also a member of the Northern Ohio American Red Cross Blood Services Committee and the Sickle Cell Subcommittee. Joy Hanes McQuay, who's sitting here, serves as the secretary of the Misha Chanel Saxton Fund. As a volunteer-driven 501c3 nonprofit organization, the mission of the MCS Fund is to generate unrestricted funds to support sickle cell anemia affected individuals and their families throughout Northeast Ohio. Joy also serves on the Advisory Committee for Young Lives Cleveland, an organization that creates positive, sustainable change in the lives of teen moms and their children. Her husband of 23 years, Dr. Nathaniel McQuay, and her have lived in Cleveland since 2016. And then I have Sabrina Spikes here in the middle. Sabrina serves as an American Red Cross account manager, responsible for achieving established blood collection goals, as well as advancing the organizational goal of providing diversity and inclusion education and closing the sickle cell gap. Prior to joining the American Red Cross, she worked as an operations manager for the Cleveland Clinic ambulatory pharmacies. She also serves as the co-chair of the Diversity, Equity, and Inclusion Committee for the Northern Ohio American Red Cross. So thank you, panelists, for joining us today. And we welcome questions as we're going through this, but I'm going to go ahead and get started with our first panelist, which I believe we are starting, if I can find my questions, with Consuela. Consuela, can you help us understand what your role is at UH?
Sure. So I'm a nurse practitioner with the Adult Sickle Cell Clinic. I am one of 3 nurse practitioners who take care of sickle cell patients at Sickle Cancer Center. I see patients strictly on an outpatient basis. I have 2 colleagues who see patients if they are admitted to inpatient service, and each one of those nurse practitioners has 1 day of clinic with me during the week. And so when patients come to see me, they're coming for routine visits. They're coming in sometimes with sick visits, particularly this time of the year as the weather changes, we're seeing more sick visits. But they also come to me to evaluate treatments, to evaluate their blood work. They also come to me before they receive blood transfusions. So transfusions are one of the ways that patients are treated for their sickle cell disease. We do have some medication therapies, but I would say we've got about 350 patients in our clinic at University. Of course, there are other centers in the city, and about 55 to 60 of our patients in that total number of patients receive blood as a therapy for their sickle cell disease. They receive anything from a simple transfusion, which is exactly what it sounds like. Patient comes in, they get an IV, they get 1 or 2 units of blood, perhaps even 3, depending on how low their hemoglobin is. They can also receive an exchange transfusion. We have a partial, and then we have a full exchange. The partial is not as many units of blood. We take some of their sickle blood out if their hemoglobin is high enough, and then we transfer anywhere between 1 to 3 units of blood based on what their hemoglobin, how their hemoglobin rates. We've also got the larger exchange transfusion where we take out, we remove more blood, and we actually give them more units of blood. Can be as high in our clinic. Usually I think the norm is about 9. I think the highest is about 9 units of blood. And so for our simple transfusion patients, they come to see us every 4 weeks. So every 4 weeks, that's 1 to 3 units of blood for probably about 10 patients. We've got patients who get those partial exchange transfusions. They get anywhere from 1 to 3 units of blood, and that's also every 4 weeks. That's probably about another 5 to 10 patients. And then we have patients who are on full exchanges. And those patients, again, receive up to, about 9 units of blood, depending on, their need. And in a week, so the remainder of those patients are full exchange patients. Again, up to 9 units, they don't necessarily receive 9 units, but those are anywhere between about 4 to 7 weeks, and we've extended that interval because of, our shortages. It usually was about 6 weeks. We've had to extend that because we've had to make some really tough decisions about who would receive blood and how often they would receive blood.
How critical is it to have the right matched blood?
It's very critical. And so to illustrate that point, we have patients who we've had to take off of transfusion protocol because those units that they received, they were a match. However, like you stated, patients will develop they'll develop antibodies, or the easiest way to put it is sort of like an allergic reaction. If they get that blood again, if they develop that antibody, it could cause some very catastrophic consequences for them. So there are patients who have had to be removed from transfusion protocol because the list of matches goes from a local search to a regional search to as specific as a worldwide search. We have patients who, if they're in need of transfusion for an emergent condition, it could take several days before we find blood, and those patients sometimes have to be searched for at the World Blood Bank. And so it makes it pretty tough if a patient is critically ill and is in need of blood and isn't able to receive it because there's maybe one or two people in the world who are able to donate that.
You've actually been involved in some of those searches, and it's kind of, I know you've been involved, I know I have too, in my 21 years, where you get a phone call that says, you know, there is a donor that lives in this place and you need to contact them and they need to come in. I mean, it's actually, it's scary, but it's actually like rewarding because I get to really make an impact on that. So what one thing do you want everybody listening today to take away?
So the one thing I want everybody who is in this room, who is on this call, who can communicate this to anyone that they come in contact with, if you are not a blood donor, please consider it if you qualify. If you are an African American person who is listening to this call and you are not a blood donor, I would encourage you to participate if you don't already. I would also encourage you to bring someone with you, a family member, a friend who can donate blood. It is critical that sickle cell patients receive blood, and not just sickle cell patients. You know, I like to think of it in terms of anyone in this room, anyone on this call is 1 or 2 steps away from a catastrophic event. You may come into the hospital and nobody knows your name or anything about you, and you may need a blood transfusion. None of us want to be in a situation where we need blood and can't get it. And so it is critical for us, not only in this room, for African American donors and African Americans who are eligible to donate, to do that. Because I've had to make some very, very tough decisions, things I never had thought I would have to do in my life, things I don't feel good about doing. Having a conversation with a patient in an exam room, you know, we don't have blood. I can't give you your treatment. And it's not because I don't want to, it's because we don't have it. And so, and I've had to do that more than once. And it is heartbreaking. I feel absolutely sick about it when I have to do it. COVID definitely, you know, threw us into that vortex, and we've had several iterations of it since that point. So if you can donate blood, please, please, please come and donate blood. I am here every 8 weeks without fail. Sunday is my day. I'm here 45 minutes. I walk in the door. I go for the screening. I donate blood. I'm out the door in less than an hour. My goal is to get on the apheresis machine because I want to be able to have that experience, but apparently I leave my veins at home. So it's a little harder for me to donate, but if you can donate, please come and please encourage someone else. I bring my mom. I will bring anybody with me who wants to come. It is that important.
Thank you, Consuela. Our next panelist is Glinda Dames-Fincher. Glinda is actually joining us virtually. Glinda, if you can come off mute and on camera. Hey, Glinda, how are you today?
Hi. Excuse me. I am hanging in here.
You've been living with sickle cell your entire life. Can you share with us what it's like?
Well, sickle cell disease is, of course, it's genetic. So, and it begins to manifest itself within 4 to 6 months of birth. So you can't catch it. It's when the sperm and the egg come together, that's what you are. One thing about sickle cell disease is it varies from, complications can vary from person to person. In my experience, I did not have a whole lot of issues as a child, but once I was in college, I started having more severe sickle cell pain crisis. I also got a leg wound, an ankle wound that started. And many people don't realize that, yes, with sickle cell disease, we can get wounds below the knee, um, like diabetics do, but ours are actually, with sickle cell disease, are actually, our wounds are worse at trying to heal them and keep them healed. Plus, our wounds are extremely painful. So I started, what was it, my sophomore year of college is when I started having a leg ulcer. So I was working on my degree in medical technology, which now they call it clinical lab science, so that people know what that is. So I got a bachelor's degree in that field from University of Cincinnati, and then I came back to Cleveland home uh, and began working in a chemistry lab. And so uh, I was on my feet a lot, but at that time my leg ulcer was wound was closed. Um, Within a few years of me graduating from college, I got married and I had a son, and he just has one gene. So from me, his father has both normal genes. So my son has sickle trait, meaning he's a carrier, not the disease, but he can pass it on to an offspring. So it was within a year after his birth that things got more. I began to have more crisis. I was having them every month around the time of my menstrual period, and that does happen in few sickle cell patients. But I also was beginning to work with another sickle cell affected person, and we started an adult sickle cell support group here in Cleveland at that time called Cuyahoga County Sickle Cell Affected Families. And both of us running the group, founding the group, had sickle cell disease and worked full time and had children and so forth. Um, but what began to happen with me is we noticed blood transfusions were what I had to have to keep my hemoglobin above a certain limit. If it drops below that limit, which normal for me is half of normal. So when people talk about sickle cell anemia, this is not a little iron deficiency anemia. Sickle cell is not an iron deficiency anemia. It's a hemolytic anemia, meaning our red blood cells only last less than about a tenth as long as normal cells. Normal red blood cells last about 120 days in circulation. Ours only last about 10 to 20 days. So with sickle cell, a half normal red cell count is what we live with. So a lot of fatigue and the sickle cell pain crisis are all of a sudden causes a lot of interruption to your life. All of a sudden, you have no warning. Um, I can go to bed feeling fine and wake up a couple hours later in horrific pain that requires, it's so severe, it requires narcotic pain medication. Red blood cell transfusions have kept me stable for the chronic transfusions, like Nurse Consuela said. I get every 4 weeks. I get 2 units of red cells. They do a partial exchange. They remove a unit to try and keep my iron load down, and then they give me 2 units. I've been getting that every 4 weeks for about 23 years now. That keeps me pretty stable out of sickle crisis. Plus, it helps uh, keep my leg wound area healed. And as I said, it varies from person to person. Some people get the same treatment I get, but they're still having sickle crisis, but maybe other complications that they need to have treated or lessened. Um,
Linda,
and
what would you like to see everybody, what do you think that we can do to help those living with sickle cell?
the biggest thing it is the blood donation. We have a few different treatments, medications, but they don't work for everyone. And um, but blood transfusions are, for my life, basically are a miracle. Um, Also, if we need surgeries, we need that blood. I do advocacy for about 40 years. I have had so many pass away before me because I'm 63, which is old for sickle cell. Um, the average is running between mid 50s to mid 60s, but we've got a lot of 30 and 40 somethings that are passing away. And I've got friends who they need 6 units every 4 weeks, and they're only able to get 2 or 3 units now. This is how bad the shortage of blood products, of red blood cells, especially for sickle cell patients. And there's also cancer patients that are African American. If they need a lot of platelets or red cells, they can also be affected. So blood donation is such a blessing to all of our lives. I mean, it's I would be blind. I would have no hands and feet. Um, Multiple things. Uh, I've had in my lifetime, just to show you how important this is, I've had over 600 units of red blood cells. And because they finally realized about 30 years ago that they need to come from people of the same ethnicity to match as closely as possible, I am still able to get blood. I've known people that have passed away because they were with sickle cell complications because they were so immunized against any blood products till they couldn't get any more blood and they died a horrible, painful death. So it's very important for the African American community to please donate.
Thank you, Glinda, for sharing your story with us, and hope you feel better. Hope you feel better soon.
Yes, my transfusion is Friday. Can't
Okay,
wait.
there we go. Joy, why was the MCS founded?
So our organization is named for Misha Chanel Saxon, and she was born in October of 1995 with sickle cell disease. Her mother, Pastor Teresa McQuay, knew that she carried the gene, but her father did not know that he carried the gene. And unfortunately, due to complications and the miseducation of sickle cell disease, Misha passed away in December of 1996 at only 14 months old. So her mother turned that pain into advocacy, and she's been an advocate ever since. She worked with local sickle cell advocacy groups, and she served on the board of many of these groups. And in 2017, a coworker, one of Teresa's coworkers, was hospitalized for a couple of weeks. And because she was hospitalized, she did receive a paycheck. And, she was talking to Teresa, and what happened is none of the organizations that Teresa had volunteered with could provide any financial support. And being hospitalized and, of course, missing paychecks is very common for people with sickle cell disease. And these organizations couldn't provide any financial support because that wasn't a part of their charter. So Teresa had a 50th birthday coming up, and her husband was going to throw her this huge birthday party, and she turned it into a party with a purpose. And so in 2018, celebrating Teresa's 50th birthday celebration, the Misha Chanel Saxon Fund was born, the MCS Fund.
What are the goals for the fund for working in the community?
So our goals are education and advocacy. And one of the biggest things that we do is because of that young lady that we couldn't provide, that couldn't receive financial support from anything else, from any other organization, is we have scholarships. And up to 2 times a year, a sickle cell patient can receive, an adult sickle cell patient here in Cuyahoga County can receive up to $150. And we provide assistance with everyday basic needs, utilities, rent, food, medical supplies, gas, whatever they need, they can fill out a scholarship application. And our goal is to just help with everyday basic needs.
And what do you see as the greatest need?
The greatest need is education about sickle cell disease. We are a 10-member board, and several of us carry the trait, but we found that we didn't know a lot about sickle cell disease, so we had to educate ourselves. And our goal is to help educate the community on the needs of sickle cell disease. And twice a year, we host a blood drive. In March with New Beginnings Ministries, and the Red Cross comes out. And then in September, which is National Sickle Cell Month, we host a blood drive. And our goal is to just ask fellow African Americans in our community to come out and donate blood. We work with the Red Cross, we provide education, letting people know what they need to do to prepare to give blood, because we're finding that a lot of African Americans have never given blood before. So sometimes there's a little apprehension and there's a little fear associated with it. So we work very closely with the Red Cross to try to educate people on, you know, what do you need to do to prepare to give blood, and just how easy it is to give blood. But more importantly, how important it is that African Americans give blood for those with sickle cell disease, trauma patients, just people in need of blood.
Thank you. So Sabrina, what's the Red Cross doing?
I think we touched on it a bit, that we have a goal to kind of triple the minority donations by 2027. One thing that we've done is partner with community organizations, from faith-based organizations, minority-led organizations, to help us to throw or host blood drives that are either minority-specific, like Joy just talked about with New Beginnings Ministries, or just really encouraging minority blood donation through incremental pipes throughout the community. So that's just encouraging people to go out and donate at any blood drive that's held within your community. In addition to that, education has been extremely important, because again, as Joy talked about, a lot of African American donors, if you're a first-time donor, you don't know how to donate. You don't understand the process. There's a fear even attached with it. So providing that education throughout the community, making sure that people are aware of the process of blood donation, how to prepare to donate, has been extremely important for this initiative, and making sure that we encourage and increase minority blood donation. Another thing that the Red Cross has done throughout this initiative, we also provide sickle cell trait testing. Prior to 2006, but since 2006, in Ohio, all newborns are now tested for sickle cell trait testing. But if you were born prior to that, you may not know your sickle cell trait status. So that's something that has been something that we make sure that the community is aware of, because people are coming out to donate to maybe even find out if they maybe carry the sickle cell trait gene. But you do have to identify your race when you are donating blood in order for that testing to occur.
Are there difficulties in recruiting African American donors?
Yes. So part of the difficulty stems from just the general mistrust of the healthcare community. As I think everyone, hopefully in the room and on the call, you're aware that there is some mistrust of the healthcare system just within within the community, within the African American community. So the difficulty has just been to make sure that we're kind of dispelling those myths, making sure that people are comfortable and understand the process of blood donation through understanding how the process works, and also how to prepare. But it's a cultural shift. And that's, I think, the difficulty of it. It's not something that we can just kind of go in, tell people to come out and donate, and people are in those fears are going to just go away. This is going to take some time, and it's going to continue to take an effort, which we've all been kind of working on, but we have to really continue in order to make sure that the community trusts us and understands the importance of making sure that this blood gets to the patients that are in need.
And the $64,000 question, how can we help?
We've touched on it a bit, but donate, donate, donate. You know, go out to donate, encourage others to donate. If you're unable to donate, you know, please encourage someone else to donate. And also, if you're unable to donate, you can help by volunteering as well. But we really want to continue to spread the word throughout the community that people need to go out and donate, understand how this helps sickle cell patients and other patients that are in need. And it would be wonderful if we could also, you know, continue to work with community partners to host blood drives or support blood drives that are already held within the community.
Thank you. Thank you to all of our panelists today. Really appreciate you taking the time to be here. And everybody that participated virtually. The meeting is recorded, so for those who weren't able to attend, we'll be able to provide a recorded session.